Bismillahirrahmanirrahim. Wassalatu wassalamu ala Rasulillah. The invited excellencies, our dear partners, the media, and all the Asturians. It's a very proud moment for us at Aster. Something which touches our heart, which is very, very genuinely required at this time. As has been mentioned by my daughter, Dr. Zaba, this is a time when we should all be looking at what we are able to give back rather than what we are getting. We have been all of us sitting in this room have been blessed by Almighty, blessed by this great country, the rulers, visionary rulers, the benevolent rulers of this country, who have given us an opportunity to reach where we are now. And that has been something which has helped us to reach the positions. And when we look down, we see a lot of suffering, lot of requirement down. So we thought that in this year, where the rulers of this benevolent country, this oasis of peace and prosperity in the midst of all the calamities that is happening around, we thought that it is our duty to join that bandwagon of giving back, which was initiated by the President of this country, His Highness Sheikh Khalifa bin Zayed, as well as the Prime Minister, His Highness Sheikh Mohammed bin Rashid, and the Crown Prince of UAE, Abu Dhabi, His Highness Sheikh Mohammed bin Zayed, and all the other rulers, Supreme Council members. We have to give back to the people who require our help. And as a healthcare organization, we are privileged to do that every day, because in our business, touching the lives of people is part of our everyday life. So we thought that we should set an example by doing something. This is our 30th year. I came here in 1987, just started a single doctor clinic, and now we have reached a position where we could give back to a large extent to people, and we thought that we should do that. And more than me, it is the people who are in the organization who are interested to do that, and the people who are supporting us. I'm really thankful to all the employees, the Asturians who are part of this. And I'll just give you a brief what this is in 5 minutes. Aster 30 is actually a celebration which we are doing at our 30th year. And as I already mentioned, we thought that the most important part of that should be giving back rather than getting anything. So the important bucket of activity for Aster 30 is giving back. In the giving back, we have mainly one activity, and that is the Aster Volunteers. Aster Volunteers, as the name suggests, is actually has to be seen in two lights, two angles. One, Aster Volunteers as a noun, and Aster Volunteers as a verb. Aster Volunteers as a noun is what we are launching today. That's the first thing that is going to happen. We want to make a volunteer force which will be helping people. We have 20,000 employees worldwide, 10,000 in the GCC countries, and 10,000 in India and Philippines. And we want to make a volunteer force of medical professionals who will give back to the society. We also want to invite others to join that. And that will become a great moment, and we could together do a lot of things in the next many years. So that is Aster Volunteers. The volunteer force will be touching lives in many ways. For example, even a person who is not having any qualification but has some time to spare. Maybe he is an engineer or a chartered accountant. If he thinks that he has half a day to spare in a week, can volunteer to give that time for the benefit of people. Maybe there is somebody who requires help at home to look after a special needs child, and the father, mother are tied up with the child every day 24/7, and if they get a day off or half day off for their purpose, and if there is somebody to take care of the child, that will be that's what a volunteer could easily do. Or there may be somebody sitting at home who has to go to the hospital, doesn't have the transport, or maybe he requires a wheelchair to be taken to the hospital. A volunteer can easily do that. This can be done even by people who are not medically qualified. Medically qualified people can do a lot. Our doctors, nurses, as well as people from outside can volunteer to do medical activities, like we, for example, have decided to do 5,000 surgeries free of cost during this year of giving, or Aster 30. I'm very happy to say that internally we opened the website 3 days back for our people to join. And as it stands today, when I climbed onto the stage, I was just finding out, and we have about 5,650 people from the organization out of the 20,000 who have already joined Aster Volunteers. Now, after the launch today by the Excellencies, this will be open to public, and we hope that there will be large number of people who will volunteer. We will match them. What is their skill sets, what they can do, and who requires that, and that will be matched, and we will try to do that. So that is Aster Volunteers as now. Aster Volunteers as verb, what we do, what we offer. I just want to give 2 examples. There are at least 15-20 things which are given on the website, but I just want to give 2 examples because we are going to have some part of that function here. One, we have already started doing a lot of things, and the most important one thing which we did recently is to start a medical clinic in Jordan to support the refugees from Syria. And we already have doctors who are working there and who are providing support to the refugees who are there. This is actually a part of that. This is actually something now happening there. Our team of doctors and nurses and paramedical staff are providing that support in Syria, in the refugee camps. Now, disaster happens in many ways, and we know that there is a human tragedy happening in Africa. 4 countries are affected, famine affected, and millions of people are actually dying or near death because of the lack of food. And we thought that we should do something for that. And so we looked around and found that already the UAE government, Dubai government, the Dubai Awqaf and the Minor Affairs, they have started a campaign in association with the Selma Food. So they have food packets which can be sent, very hygienically packed food packets, which can be sent to Africa, and we thought that we should do something. And we requested our employees, our staff, Asterians, and they were so generous that already we have collected 2 container loads of packets, funds for 2 container loads of food packets at a cost of about 1.5 million UAE dirhams, and we are sending it through the representatives of Awqaf very soon and we will be launching that. So these are some of the examples which I am giving, but there are a lot of things which are happening in different parts. We are providing free cardiac surgery to children. We have already done 30 such surgeries in Philippines as it stands, and hundreds of that in India. So we will go forward and do this and won't stop it at the end of Aster 30, but will continue that. We are extremely thankful to all of you who have come here to attend this launch, and hope that this message will spread. You will all become part of Aster Volunteers, and we can together take this forward to greatest height, because the most important thing that we can do is not to talk, but to do the smallest act of kindness. This was again told by many people, that instead of thinking and talking, let us do something which is the most important thing. And we are trying to do that. And we at Aster commit ourselves, our expertise as well as resources for taking this forward. Once again, thank you very much for being with us, and you will see what we are doing and what we are planning to do in the videos and all as we go forward. Thank you. Jai Hind. Assalamu alaikum.